There wasn't as much of an understanding back in March, April, of how the virus was spread. We know now definitively that the virus is spread primarily through what are called respiratory droplets. That means that as you breathe, talk, cough, sneeze, in all of these situations, tiny little droplets of moisture come out of your mouth and nose and spread to the area around you. And with normal conversation, those droplets can spread 3 to 6 feet. With cough or sneeze, they can go much farther. So one primary reason to wear a mask is for what we call source control, meaning that mask serves as a barrier from spreading those respiratory droplets that can infect others. Cloth masks can also help protect the wearer more than we originally thought, by perhaps as much as 70% or more, especially masks that have more than one layer and masks with a high thread count. It's important when we wear a mask to make sure that we wear it over the mouth and nose, and that when we put it on and take it off, we're careful not to touch the front of the mask, but rather hold it by the loops, put it around the ears. You can adjust it over the face to make sure that it covers the mouth and the nose. It's hard to know for sure how many people are wearing masks, but I think people maybe are wearing masks because it's required, maybe not wearing them in other places where they don't feel themselves to be as much at risk, but they are. Gatherings in their homes or other social gatherings where they feel comfortable because they're with people they know, and maybe forget that those people could still be infected with the virus. When you're with people that you aren't household contacts, it is important to wear masks when you're in a vehicle. Going out to eat, obviously you can't wear a mask the entire time, but when you're not eating or drinking, you should wear a mask. We don't want children 2 years of age or under wearing masks. Folks who aren't able to manually remove a mask without assistance shouldn't be wearing one. But there really aren't that many other medical barriers. When I see people not wearing a mask, often it's simply because it's uncomfortable. People feel it's hard to breathe. Sometimes they don't want to wear a mask, I think, just because it's socially awkward. We rely so much on facial expressions to connect with people. Some of us who are hard of hearing rely on reading people's lips to be able to communicate. So it truly can be a barrier to communication, but it's always a matter of weighing priorities. And when we're in the midst of a pandemic where this virus can so easily be transmitted, even by people who don't have symptoms but happen to be infected, I sometimes hear parents saying, I don't want my child to wear a mask. I have 4 children, and it always amazes me how resilient children are. I wouldn't have any reservation about a child wearing a mask to protect themselves and others. That's especially important when we know that kids are very often asymptomatic spreaders of COVID-19. We are seeing 5 times the number of people in the hospital today that we saw just a few weeks ago. And sadly, people of all ages are getting sick and hospitalized or dying because of this virus. The rate at which people die with COVID-19 is several times that of flu. So it is a much more serious disease. So many people do seem to have fairly mild illness with COVID-19, and they get better quickly. What I see is the people who end up sick and in the hospital, the people who end up dying, the people on a ventilator, or even the people who recover but have profound fatigue, cough, headaches, other symptoms that linger for literally months. So I'd ask you to remember those things if you're tempted to sort of lump this in with flu or other milder respiratory illnesses. As more and more people enter the hospital with COVID-19, there's always a chance, we're seeing it in other places across the country and across the state, that we could approach our capacity in terms of beds, or more importantly, nurses and providers to be able to care for patients. So we really need to work hard in the community to protect one another from getting sick with COVID-19. If we all do the little bit that we can, it's going to help everybody to keep schools open, keep the economy running, and most importantly, keep one another safe.